Good morning,
Hey,
ladies.
Glad to see you guys again.
It's the
yes,
trio.
we are here. We're glad to be here on this beautiful
Excited.
Saturday morning, May the 2nd. And hey, we are the trio. We are back. We've been away for a little while, but we have an exciting topic for you, and we want to get right into it. We know that there's so much going on. Our topic today is building and utilizing caregiving support. Um, and so we just want to, give you a little bit about it. Our mission is to support individuals and families. It can be, whoever your family is, through these trials that you might be going through, um, as you transition and you're carrying out what you need to do for organizing your caregiving. And I want to leave this quote with you. You don't have to do caregiving alone. Today, we are talking about building a strong, reliable care team. So just think about that. That's what we're here to talk about, building a strong, reliable team. And what does that look like? So for today, you know, think about why your care team matters. Think about who your uh, caregiving team would be. A lot of times it can be a family member, it could be friends, it could be a relative, it can be your neighbor, it could be your coworker, it could be a church member. So, as well as the medical staff that you are caring for. So, those are kind of key people that can be your caregiving team. And, when you have a supportive team, it can reduce stress, it can help improve care for your loved one, and also improve care for yourself because that way you don't feel like everything is on you. So these are just ways to think about it, um, what that means.
Absolutely.
Uh, absolutely. And like getting ready for surgery, you should be asking for help. You should be coordinating schedules, communicating with medical staff. Preparation for teamwork leads to smooth outcomes, and it makes the process so much easier.
Absolutely. So, planning, this is important planning for gaps in care. Like, for instance, summers, which is coming up, transition, making that transition. So, care changes during when? Think about it, summer months, vacations, life transitions. And here's some practical tips for thinking about that time is cross training your caregivers. Very important. Share updated contact lists. Document routines and medical needs. Yes. Um, in this, the key message is don't wait for a gap. Plan ahead.
Mhm.
Important.
It's important. I
Mm-hmm.
like that. Don't wait for a gap. Plan ahead. So under and maybe you want to talk about this, Anna, the medical system insight.
So, um, I am a big proponent of signing up for these electronic portals for your doctor's offices, your hospital visits, because these things allow you to have hands-on information when you need it. And honestly, let's be let's be real. Every day you forget. You're at every appointment with your mother and you're going to forget something. So pulling
Hmm.
up and signing up to these things, it gives you the access. So you don't have to try to remember. You have the information at hand and you're able to communicate with your care team all of the valuable information that's needed, especially when it comes to diagnosis and medications. Um, some people take a lot of medications.
Yeah.
It's a lot to remember on your own. Log in, cross check, cross reference, because not all the systems are connected. create a sheet that you post up so that way everyone has eyes on the key factors. And if an emergency happens, God forbid, you're prepared.
Absolutely. Absolutely. What about I'm gonna the appointment access. You said something really key, Anna, where you said sometimes the different systems are not connected. And I guess that rolls over into the appointment access challenges, where some of the barriers are transportation, especially for elder patients, getting them there. How are they going to get there? Who's going to stay with them? And then technology, the my chart access and the portals, which you already mentioned, Anna, and it's so important to be able to have login and passwords for that, and
Mm-hmm.
scheduling limitations, like which kind of you already shared about that. But a solution is to assign a care coordinator within the family or your team. So that's important. That's an important solution. Ensure at least one person can access the patient's portal, all of them, or one of them, I don't know, and build a backup transportation option. That's
I
a lot.
let me add to that. A lot of insurance companies offer transportation.
Mm,
Find out what your medical benefits are with your insurance plans,
Hmm.
so that way you're prepared. And in New York, most of these providers need 3 days notice to schedule the transportation. So unless it's an emergency where the provider's office can make that call, but check into your benefits. There's a lot of information out there.
Absolutely.
that's powerful, powerful. Because you don't always think about that, right? You just say, "Oh, I got to have somebody take me to the doctor," but that is real key. Um, we've gotten this is some really great information, and we wanted to just give it to you, hit some points so you can think about it. Um, we want you to build your caregiving team. That's what we're talking about. Include both personal and professional. What does that mean? Whoever personally in your household can, or in your group, whether again we talked about friend, relative, or whomever, and then the professional side, your
Hmm.
doctors, the nurses, a social worker. Those are people that help build your team, that can help you when you build a team. And then communicate and coordinate things that are critical that people need to know, uh, so that everyone is aware, or those specific people are aware. And we want you to be a, advocate. That's being an advocate is a part of caregiving. And it might not be you, the advocate. You might have to assign someone as a role to be the advocate, to say, look, what else do you think we need? So it's not so much on the caregiver, but in those different roles, someone could be the advocate for your team and go into, oh, I think we need this. Have you added that? Have you considered this? And then there's questions you can ask a social worker or your medical staff on what is a good team, and how can I be effective? How can I be effective as a caregiver, and how can the people that are on my team be effective? So I want you to think about that.
That is a lot to think about, but important. And also we want to leave some national insights, because sometimes you feel like you are the only person that is dealing with this. And in brief, I want to say millions of Americans, millions
Mm,
are caregivers, and many experience burnout due to lack of support. And this is why building a care team is not optional; it is essential. And I want to share with you some statistics. Um, about caregivers in America. More than 53 million Americans are providing unpaid care to a loved one, according to the AARP and the National Alliance for Caregivers. Nearly 1 in 5 adults is now serving in a caregiving role, many
mhm.
balancing job, families, and their own health and other children. I mean, we can get into that. Research published in journals such as the Journal of the American Medical Association shows that caregivers experience higher rates of stress, anxiety, and depression, especially when support systems are limited. And finally, the Centers of Disease Control and Prevention reports that caregivers are at increased risk for burnout and chronic health conditions due to prolonged physical and emotional strain. And those are what the numbers are saying for the people that
Mhm.
are in our country.
Isn't that something? That's just, it's
That is
amazing.
amazing. Yeah. So we're
You,
not
you
alone.
wouldn't
We're not
you
doing it
wouldn't
by
think those
ourselves.
numbers are so high.
Hmm. You would not, but they are, and
They
it's real
are.
Yeah,
life. You know,
it's
you can
Absolutely.
just
absolute.
look in your family and realize that this
Yeah.
Yeah.
is it. Hmm.
So that means it's important to speak up. It's important to ask for help. It's important that you don't isolate yourself. Communication is key. There's so much out there, and honestly, you think the people around you are not willing to help. If you ask, there's certain levels of help you can achieve, whether it's a number to call, whether it's a place to visit, or whether it's just, well, you know what? I have an hour today. Let me go and sit with my friend so she could just have some real company aside. And you would think it doesn't make a difference. It does. So
Hmm.
it's important to talk. It's important. We need one another, and as much as we are into technology, that human touch is so powerful.
It's
Absolutely.
key. It's key.
You
It
gotta
is
have
really
it.
key. Hmm. So as we get ready to first, we're excited that we're together, but
Yeah,
we
it's
wanted,
been a
we
minute.
wanted to. It's been a minute, but we wanted to share this important topic, especially we talked about. Um, as you go forward, I want you to just remember that care is not meant to be carried alone. We don't want you to feel alone, even though there is a lot to it. Um, but it's built on a community. And whoever that community is, it's guiding you through love and grace. So keep that in mind. It's really through love and grace that you're taking care of your caregiver, love and grace that you're able to do that, love and grace, even if it feels uncomfortable. But we're here, um, any step of the way that we can support. And together as a
Yeah.
group, together, we can care
Yeah.
for one another better. There may be a conversation you have somewhere in your goings and comings, and that caregiving comes up. And in that conversation, there may be more information. So we are thankful you're here. We want you to subscribe. I think we got a little subscribe button on YouTube, which we're excited about. And we'll
Absolutely.
continue to share things, um, what someone needs. You'll join us again. We'll be doing some more lives. And we definitely want to thank you for joining the Trio Cares. And on this topic, utilizing caregiving support.
Yeah.
So
So
thank you.
before we go, just wanted to say how if you're reaching out to us, how we can help you.
Mhm.
So I'm Anna. I'm a medical secretary, and I help you get your medical records and information together for yourself and your family. So if you need help getting that stuff done, reach out to the triocares at gmail.com. And I think Leslie and Renee will tell you guys how they each can help.
Okay.
And go ahead, Renee.
Okay, I'm Renee, and I represent the multi generational household and the sandwich generation. And basically, that is where you are taking care of a senior. You're a caregiver for someone, and then you're also caring for children at the same time. And so that there's a lot of maneuvering in there. There's a lot of different scenarios that can come up, dynamics that make up sandwich generation. We talked a couple weeks ago about the sandwich squeeze because you're squeezed in the middle is basically, and we don't want you to be squeezed and overtaken. We want you to survive. So that's just another leg and another arm that we will hold your hand and talk with you about how you can better manage and build your team for the sandwich generation and not be overtaken in the middle of that.
And
And I
I'm
am very
Leslie Bourne. Leslie Bourne's the CEO of your household. And part of my role is to help you look at different areas of your life as it relates to your household versus a business. That can mean paperwork and having things in order. That can mean you have different situations that you're trying to categorize and put them in certain areas and work through different actions or statuses in your life. Um, that's caregiving. It runs the gamut, so I can provide support. And as we continue to move through this, there are different topics that you'll see us talk about that'll make you think, oh, what am I doing as the CEO of my household? What are things that I need to improve on? How can I organize certain things? So that's our team of the trio. And we're again really excited that you joined us. We hope that and you find something of interest and also share this um, recording or live so that you can help those that you might support. Not only you getting support, but those that you might support in various ways. So thank you all.
Thank you. Thank you for
Thank
joining.
you.
We'll talk to you soon.